Medicaid expansion would do more for people who have regular insurance and Medicare than it would for those who actually need Medicaid. And the part of it that people need to understand is that right now, if you have Medicaid, right, and you want to go to the doctor, go to the urgent care, whatever you want to go to, you're going to go. Sometimes there's no out of pocket costs if you're a kid. Kids to chill can get no out of pocket. But other than that, you got to pay something a lot of times when you go to these places. When you go to the hospital, whatever's going on with you, they got to stabilize you. So that person with no insurance is better off a lot of times having no insurance and just going directly to the hospital. Now, where it becomes an issue, and I know what they're going to say if they heard that. Oh my God, you're like anti-Medicaid expansion. I'm not. I just don't think that Medicaid expansion without uplift or eradicating a certificate of need will do anything. But if you go to the hospital with no insurance, you're going to get seen for free and sent home. If you go to the doctor and you have Medicaid, you still can have $100 copay at urgent care. So at what point do you say, if I am the person who's really being hurt? The person who's being hurt, unless it's catastrophic, so you have cancer or something like that, the person who's being hurt the most is the person who's also in that emergency room, who has a true emergency, who has Medicare or private insurance, and what would have been a 1 hour wait is now a 12-hour wait, simply because everyone who could have gone somewhere for a code are all being checked in this hospital emergency room. And to me, I don't know why people aren't talking about that more. I don't know why it's being brushed over. I don't know why. I think, again, Medicaid expansion is fantastic. But again, if we gave everyone Medicaid in every state right now, very little would change. Very little would change, because you still don't have enough businesses to help said people. Most hospitals require a certificate of need. Most people don't have the capital to prove the need. And most governments don't move fast enough to get one built anyway. So it's not like something that's going to do, it's going to be like overnight. It's fantastic. Even if they expanded Medicaid tomorrow, we couldn't even reopen the hospitals that have been closed. We couldn't reopen the nursing homes that have been closed. There's nothing we can do. And think about it like this. Shortage of doctors in rural communities, right? Expanding Medicaid is not going to make you get those doctors back in that community. They still have a $500,000 loan, and you're not going to be able to pay enough to get them to come to your community. So the real question is, if you're on Medicaid, what do you suppose you do?